Headlines in the pandemic, new COVID cases in North Carolina at more than 8,500. That high amount is due in part to technical issues in reporting cases this week.
CBS 17 is team coverage. Our Capitol reporter Michael Hyland breaks down Governor Cooper's news conference today. Also, the critical needed area hospitals dealing with a surge in patients. And we're answering your questions about the latest stimulus rollout. But first, the state's revised COVID-19 vaccination plan. It will still be months before most people who want to get a vaccine can do it. Leaders of Operation Warp Speed acknowledge how slowly the process is actually going, but say it will improve.
Our Capitol reporter Michael Hyland is live in Raleigh getting answers about how this is going in North Carolina. Michael.
Right, employees at hospitals are among some of the first people getting the vaccine, but federal officials say this initial rollout is not going as quickly as they had said.
The first doses of the COVID-19 vaccine are going out now, but leaders of Operation Warp Speed said Wednesday the U.S. is not likely to meet the goal of 20 million vaccinations by the end of the month. Data from the CDC shows just over 583,000 first doses of the vaccines have been allotted to North Carolina so far. State data shows just over 63,000 people have actually gotten them. President Trump tweeted Wednesday that states need to get moving. President-elect Joe Biden promised a larger role by the federal government.
But as I long feared and warned, the effort to distribute and administer the vaccine is not progressing as it should.
Officials with Operation Warp Speed said they're getting vaccination data on a 3 to 4 day lag. North Carolina officials are still trying to get access to data to find out how many people in long-term care facilities are getting the vaccine. That's being managed by the federal government through a contract with CVS and Walgreens.
Vaccine allocations or uptake usually starts out a little slow, and then it increases exponentially and very rapidly.
State officials released a new prioritization list Wednesday of who gets the vaccine when, saying it'll be springtime before anyone who wants to get it can get it.
I think everyone across the state that is working on vaccine administration wants to make sure we can get vaccine to people that need it as quickly as possible.
Dr. Mandy Cohen said initial supplies will still be limited.
I know that there's going to be a maturing of this process as we go forward. It's new for all of us.
Among the changes made today, the next phase of vaccine distribution is going to start with anybody who's 75 and older, and then it's going to move to healthcare and other essential frontline workers as more doses become available. Live in Raleigh, Michael Hyland, CBS 17 News.